So let's actually talk about some ways to maintain and sustain these arches, right? Let's talk about ways to activate and keep the activity of the lumbricoids, keep those little worms moving, and then how we can sustain this transverse arch and exercise the transverse arch, okay?
Walk on a sandy beach without shoes.
That's one of the best.
It was like inspiration.
It is. Walking on the sandy beach, barefooted. And with just a little bit of warm water running up over your toes as well.
Could you write that in a prescription form, please, Darren?
Yes.
Mandatory vacation, okay.
Yes, exactly. And it has to be 21 days minimum. Anything less is not effective.
Quick question.
Please.
Instead of a callus, could it be like just a little lump that's really sore?
Yeah, so the question is, instead of you being able to see a large callus, could there be just a small lump? And yes, the answer is yes, that can be there.
I'm following.
And that's what we'll see, though, and it's very, very common. So let's actually show just a couple of things this evening with respect to the feet. And I think you'll find it, I find it fascinating because, again, the connection, I want to show you that connective link between the health of the feet is very, very indicative and reflective of the health of the spine. Okay?
Is scoliosis tied into the foot to feet problem?
Okay. So here raises a spinal question. So since we're talking about the spine, does then a presentation of a curvature in the spine called scoliosis also link up to something with the feet? Most of the time, no. Okay? This is actually a higher functioning or higher functioning fault, if you will. Usually what we find with scoliosis is in the back side of the brain is the cerebellum, and what we find is a cerebellar fault more commonly, which leads to a hemispheristic fault in the upper bigger brain. And so we usually look at this as what we call a hemispheristic fault, or scoliosis will be a congenital fault. Okay? A congenital scoliosis is when the vertebrae, instead of being square, straight, so what we'll see is instead of this, let's actually draw first the normal. Instead of having a nice squared vertebral body, what we'll find is what we call a congenital wedged or blocked vertebrae. And what will happen is these wedged blocked vertebrae like this will actually cause then the entire spine to tip in that direction. Okay? So that's a congenital scoliosis. And the quickest screen for a congenital scoliosis is when you look from behind, you'll see the curve in the spine, and then when you tip them forward, that bend doesn't disappear. Okay? Whereas a brain-based scoliosis, they'll be standing and there will actually be this bend in the spine, but then when they tip forward, that spine will actually relax and align out. So you'll see it will go straight forward into a perfect alignment again. Okay? So in that case, then what we'll do is work on that brain and actually use either a red and white strip or a temperature, cold one ear, warm one ear, to bring up the activity of the brain one side to the other and help to correct the scoliosis.
So that's making the muscles pull, is that why it tips?
Exactly.
Okay.
So what you'll see is increased paraspinal tone on this side of the curve, right? Because it's squeezing hard. So you'll have this real strong and then this laxity on the opposite side, which is associated in the paraspinals to the tone of the muscles, or excuse me, the tone of the brain. Okay? So this brain would be very tonified, and this brain would be very weak. Okay? Which often also is very consistent with a cerebellar weakness on this side to the brain on the opposite. Okay? So the paraspinal tone is diminished on the side of the hemispheristic weakness.
Okay.
Okay? But it's due to often a cerebellar imbalance. When we talk about cerebellum, remember cerebellum is not, this is not an alcohol test. All right? and being able to walk a line. This is not an alcohol test. This is a cerebellar test, which alcohol affects first, right? So all the policemen are actually trained in cerebellar testing, neurologic testing. But what you're looking for in the child is a dysmetria. When they come to the nose, either a waving of the hand, or when their eyes are closed, that they'll come short and then find their nose, or they'll completely miss. Okay, so you're looking for some type of a dysmetric or undershooting or overshooting. They'll come in and really overpress their nose when their eyes are closed. I'm like, wow, there's my nose. I didn't realize it was that long. Okay, Pinocchio experience, right? So that's how then we start to improve that by either cerebellar type exercises with feed forward information to the hemisphere, or specifically just cerebellar exercises that are on the non-dominant side. And usually that's what you'll find, it'll be the non-dominant side.
So I'm curious, you said that the tailbone is where the nerves all come together, it's very important.
Okay.
Does that have any relation to what you're talking about in the brain at all?
So now we're talking about another type of a neural tension, if you will. And sometimes you'll see that can cause a temporary tethering of the spine, which will create then an imbalance in the brain. So the question is, where does the spinal cord actually tether? The spinal cord itself, if we're to look from the front of the body, the spinal cord itself actually ends at the level of the belly button. Okay? In other words, inside of the spinal cord, the spinal canal, the spinal cord itself ends at the level of the belly button. And from there then, individual nerves continue on down, and those form then the sciatic nerve, that's the long nerve that goes all the way to the heel. And those nerves then give innervation to different levels of the body. Right? The interesting thing though is, around the outside of the spinal cord is a sheath that is directly in contact to the spinal cord, and that is called pia mater. Okay? Around that is a very, very tough sheath called dura, durable or strong or tough, and mata is mother. Okay? So dura mata is the tough mother. And she protects the spinal cord and the brain. Okay? The pia mater is in direct contact with the spinal cord and the brain. It's the sheath that's directly on it. You can't separate it. So the dura mater would be like this sleeve, but my skin would be like the pia mater. Okay? The pia continues then, so this little cone is just that. It's the conus medullaris. Okay? But what we find is that below that, all of these little spinal nerves that come off, that's called the horse's tail, cauda equina. This horse's tail lower nerves, but this pia mater continues down, and it connects and tethers at the very end of the spine at the tailbone. Okay? So it acts then as a little anchoring, tethering point to the whole spinal cord, so the spinal cord just doesn't just contract or draw back up. Okay? So that's a little tethering point, the tailbone. Now the amazing thing that we find in the literature and in the research also is, if a child has an injury to the tailbone where the tailbone actually draws forward and is injured and tethered forward, a small or just a minute amount of tethering actually can cause in the spine itself a change in the parasympathetic output of the sacral nerves. Okay? So what they've actually shown in the research is 46% of females with endometriosis have an anteriorly displaced tailbone. Isn't that interesting? I think it's interesting because it changes then the innervation to that reproductive system. They've also shown infertility linked to that as well, which I think is also pretty fascinating. And yet, how many females, in essence, when they deliver their baby, are basically perched right on top of that tailbone as they're trying to deliver a baby? Isn't that interesting? So you actually have this tailbone that can actually move, and the position of delivery is actually contraindicated to allowing that canal to open. Kind of interesting, I think. Okay. Anyway, does that answer the question that you were asking?
Very interesting.
Yeah. So if this is tethering, then yes, it can actually create. Then this pia mater goes all the way up, and it's around the entire brain itself as well. And that tough mother is all around that brain as well. And all of that is tethered down here at the tethering point. Okay? So if that's being tethered, if there's tension or dural tension or tethering on that sleeve or sheath, you can see how then it could actually create some changes in neural output from the brain as well. Okay? So we've seen cases of migraines, we've seen cases of infertility, we've seen endometriosis, many different things relieved by just correcting the tailbone. Okay.
MS?
MS?
Any kind of, I mean, the Neuromas, it sounds like it's.
Well, an interesting thing that we're finding more, there's a researcher out of Canada right now who's showing with some of the neurodegenerative diseases, not just the inflammatory response associated with some of the autoimmunity of celiac disease, but he's also showing where if there's compression in the skull and loss of movement of the bones of the skull, that it changes circulation to the brain, and that causes these white matter lesions as well. It's actually a dentist in Canada. Pretty neat research, and he actually just did a presentation in Vancouver a month and a half ago. Met with some real top researchers there, and I think it has some promise when it comes out. So, pretty neat. Everybody good to that point then? Okay, so let's talk more about the feet. Excuse me. Thank you.
Jared, what is the point of his research?
The point of his research is if we can restore cranial movement, and also then when the jaw is in appropriate juxtaposition of the teeth and we have appropriate occlusion, there's actually an outflare of the jaw and also a pulsation of the skull.
Hasn't that already been?
I don't think it's been linked to Alzheimer's and Parkinson's.
Okay, that's okay.
It's been shown, but I don't think that they've correlated it as strongly
So
as
his
he's
study is
correlating.
showing a statistical.
The direct statistical relationship and correlation of loss of cranial movement to neurodegenerative diseases. And he's actually having some pretty phenomenal results by restoring some of that cranial movement. Okay? And then mastication or chewing, how important that is for that movement as well. Breathing is so essential. Swallowing. When we swallow, it actually pushes against the roof of the mouth, which activates the vomer, which is the plowshare. So this is way digressions, pardon me, but I get kind of excited sometimes. But this is, inside the nose is the septum, and it's a bone that's shaped like a plowshare, so it's called the vomer or plowshare. In the roof of the mouth, the palate is this way, and then from this palate then are where our teeth actually grow from. Okay? So the teeth are coming out of this, but the tongue occupies all of this space. Well, right above the plowshare is the sphenoid and the sphenoid sinus, and then there's this amazing little bone right here called the sella turcica. Yep. And turcica means Turkish, and sella is
Saddle.
saddle. So the little cowboy sits right in there, and he takes a little ride in this Turkish saddle, right on top of the camel.